Hi, I'm Dr. Mazda Shirazi. I'm the Medical Director of Arizona Poison and Drug Information Center. Arizona Poison and Drug Information Center is where physicians, pharmacists, and other healthcare providers come together to answer questions from Arizonans about their exposures, poisons, bites and stings, and exposures in the environment and workplace. My role as a medical director is to answer lots of questions. Historically, in Tucson, we have had exposure and a contaminant in our water, TCE and 1,4-dioxane, that many people have questions about. And at many times, they want to come to the clinic to find out whether the disease that they have or they're suffering from is caused by that exposure. So let me first answer that question. At this point and at this stage of knowledge, we do not have a test that can show that your exposure is causative or cause of your disease, cancer, lupus, or other diseases that you're suffering from. There are people who suffer from many conditions, and exposures to certain chemicals can cause a variety of diseases, including cancer, which is multiple diseases, as most of you are aware, immune problems such as scleroderma, lupus, and other diseases, skin conditions, and patients worry that that condition is caused due to the exposure. So let me first explain that exposure does not mean disease. Many of us are exposed to a variety of environmental contaminants, chemicals, and even radiation, but that does not mean that we all develop disease. By definition, exposures will cause certain number of people to have or to develop a disease in the future. So chronic exposures are very complex. What do they depend on? They depend, first of all, you have to have the exposure. Secondly, you have to have a length for that exposure, meaning you are chronically exposed to a same or certain level of exposure. Third, you have to have the dosage, meaning the level of the exposure has to be high enough to cause certain diseases. And fourth, it depends on one's health status. So if one has diabetes, are they going to develop kidney disease? Yes. Is it due to the exposure or is it due to the diabetes? So these questions become very complex to answer. And the best way to deal with the exposure and minimize its effect is, first of all, to decrease the exposure. And that has been done with your water agency, where they either decrease or put more water that's pure in the wells, and by doing so they decrease the exposure. The other way, and the most important way, is to live healthy. To live healthy means to have a good nutritious diet, to not be overweight, not to smoke, not to get exposed to other diseases, to get your vaccinations done on time, and to be cognizant of your work and your health environment. The other thing that one has to do, one has to have what we call a health home or medical home, where you have a doctor that knows you, knows your history, knows the diseases or potential diseases that you have, or your family history shows that your family has had. And they know what type of medication you are on and what type of work you do and what type of exposures you can have. Therefore, they can take care of you and try to keep you as healthy as possible. If you develop a disease that you might think is related to your exposure, first and foremost is to deal with the disease. So if your doctor, your subspecialist is helping you to treat the disease, please treat the disease. The first thing is to treat the disease. If you're concerned and you want to know whether it's related to that exposure and you want to come to our clinic, we are more than glad to have you there. But the way we determine that you have had exposure and it's related to the disease is to ask you about your history. How long you lived there? How long were you drinking the water? What other activities did you have? Where did you work? Did you have exposure at work? Did you have certain diseases? Do you have diabetes? Do you smoke? At work, are you exposed to other chemicals? That could explain your disease or situation. And many times, as you can deduce, it's hard to tell you that exposure is causing the disease. Usually there is an association, and that's the best thing we can do right now. Again, there is no test to say a disease is directly related to your exposure. And instead of worrying about your exposure, what I suggest doing is to eliminate the exposure as much as possible, to live a healthy life, and to decrease other activities that can be harmful to your health. If we can be of any assistance to answer any questions that you have, or you want to talk to us, you can either call Arizona Poison Drug Information Center at 1-800-222-1222, or you can make an appointment and come to the toxicology clinic. Again, realizing that many times we cannot tell you that your exposure is causative of your disease, and that you cannot have a test, and there's no test that exists that would confirm or deny your exposure. Thank you very much, and I look forward to your questions.